and welcome everyone to the webinar of the Future of Health Innovation in Asia, brought to you by the Asian Network in support from ERIA. My name is Amelia Litania. I'm Program Officer from ERIA, and we are here to discuss today an important topic of HealthTech, which future in Asia with this amazing panelist. Now, to start off this webinar, let us hear the opening remarks video by Irakli Khodeli, Program Specialist from UNESCO.
Dear organizers of the Conference on the Future of Health Innovation in Asia, the Economic Research Institute for ASEAN and East Asia, and the Asian Network, dear guest speakers and the participants of the conference, I would like to thank you for inviting UNESCO to join this important event. As you may know, promoting the beneficial use of science and emerging technologies has been at the heart of UNESCO's mission since its establishment more than 75 years ago. Through its bioethics program, UNESCO sets global and ethical standards in the development and use of medical technologies. It also promotes global reflection on the ethical issues and works closely with its member states to build national capacities so that they can apply the global norms and principles at the national level. COVID-19 pandemic has demonstrated the power of new technologies, such as artificial intelligence, to help humanity confront unprecedented challenges to human health and well-being. As health and life sciences are experiencing their AI moment, so to say, we're likely to see the accelerated adoption of AI across many areas of healthcare in coming years. With great AI power, however, in health and life sciences, comes great ethical responsibility. In this respect, it is important to note that in November last year, UNESCO's member states adopted the recommendation on the ethics of AI, the first ever global normative instrument in this domain. It calls on member states to employ effective AI systems for improving human health and protecting the right to life, including mitigating disease outbreaks while building and maintaining international solidarity to tackle global health risks and uncertainties. The recommendation provides policymakers with concrete ways to promote the beneficial use of AI in healthcare. For example, ensuring oversight to minimize and mitigate bias, or ensuring the human care and final decision of diagnosis and treatment are taken always by humans, while of course acknowledging that AI systems can also assist in their work. We at UNESCO are looking forward to working closely with all of you on translating this global ethical framework into action for a tangible, positive impact on the people. Let's harness together the incredible power of artificial intelligence in an ethical and responsible manner for better healthcare outcomes. I would like to thank you once again for your attention, welcome you to this event, and wish you fruitful, productive, interesting deliberations.
Thank you very much, Irakli, for sharing this important message on AI's role in health tech and setting the scene to our discussion. Before I proceed, let me just remind you that the participant will be able to post any of your questions in the chat box or grab the mic icons to speak during our Q&A session. Now let me move to introduce our speakers. Our first speaker here is Beth and Lopez, the co-founder and CEO at Docosan. Beth is a community healthcare worker turned entrepreneur. Previously, she was head of public affairs at Singaporean startup M-Clinica, where she led the company's public sector initiative. She served in the Peace Corps in Cambodia, consulted to USAID and the Ministry of Public Health of Thailand, and have worked in health policy and program development in ASEAN for over 10 years. Welcome, Beth. Happy to have you here.
Thank you. Great to be here.
Thank you. Our second speaker is Dr. Takuma Kato. He is ERIA's expert and the Director for Healthcare and Long-Term Care Policy. With more than 10 years experience in health service sector, Dr. Kato previously served as Deputy Director in Diseases Control Divisions as well as Medical Professions Divisions of Health Service Bureau, Ministry of Health, Japan. He has published several public health textbooks, including one focusing on environmental health issues. Welcome, Dr. Kato, and we're looking forward to hearing your insight. And last but not least, we have our third speaker, Buntongyi or Dr. Tom, the founder and CEO of Meet Doctor. He's a young Cambodian doctor and entrepreneur who has been trained at local hospital and observed at many international hospitals abroad. He's active in community projects, research, and international conferences across Singapore, US, and Switzerland. He's also a community of the HealthTech Roadmap of the Ministry of Industry, Science, Technology, and Innovation in Cambodia. His life mission is to make health equity a reality for Cambodia and the world. Welcome, Dr. Tom. Thank you for being here.
Hi, Amelia, and hi, everyone. Thank you so much for today. So excited to talk. Yeah.
Exactly. Thank you very much for the panelists to be here. So to kick off our discussions, I'd like to first hear insight from you, Beth. So you founded Docosan in 2020, I believe, the largest healthcare service market in Vietnam. Could you tell us how did you build your company and scale up to reach more than 50,000 patients and 1,000 healthcare providers in relatively a short amount of time?
Sure. And it's actually 290,000 patients per month who are active users of Docosan now. We've got over 1,800 verified healthcare providers who are active on the network. So yeah, it's been quite a journey. And when you launch a marketplace, you have a real chicken and egg problem. If you don't have doctors on the marketplace, there's no one for the patients to book. If you don't have patients, then there's no one for the customers for the doctors, so they're not so interested in joining. And so when we first got started, we really focused on centers of clinical excellence. And so back in April of 2020, Docosan was basically, we call it like a minimum viable product, an MVP. It was kind of a calendar that worked okay. The basic functionality was there. It was not beautiful, it didn't work super great, but it was enough for me to go and sit down with doctors at their private practices. And a lot of the first users that we had were also like professors over at the University of Medicine and Pharmacy here in Ho Chi Minh City. Just because I knew them, and I think academics, they're always intellectually curious. They were willing to sit down with me and kind of listen to my ideas about this crazy new startup that I wanted to get running. And so they did the initial, help me with the initial user feedback. We kept changing the software. And then when it finally came time to launch the software, we had some of the really top doctors on the network already, because it was the professors who joined us from the onset. And medical community in Vietnam is a pretty small place. A lot of the doctors have, they call it Zalo here. It's like a Vietnamese WhatsApp, but kind of better. So they have Zalo groups with their medical school classmates, and they all start talking and adding each other. Still, like one of our the fastest ways that we've been able to scale up our network of doctors comes from referrals from existing users that we have. And so I think, by focusing on that center of clinical excellence, those initial well-respected doctors in the community, getting them to join the platform in the beginning, that is how we first overcame our chicken and egg problem.
Thank you so much, Beth. I think that's also very interesting how you grow from being a center of clinical excellence to be able to grow your network to reach more doctors and users later on. So with that, I also like to ask quite similar questions to Dr. Tong, because you and your company missions as a telehealth startup is to provide affordable access, right, to everyone in Cambodia, especially undeserved population. So could you tell us the story behind it and how you grow your startup like Beth to be able to reach thousands of patients in Cambodia?
Thank you so much, Amelia. And thank you, Beth, for telling us how you grow your stuff. I think it sounds similar to what I'm doing right now, but the thing is quite different here because actually when I started Meet Doctors, it was in 2018, and I think it's quite long, it's quite long time. And at that time, I was a medical student. I trained at the hospital. I worked at the hospital. I studied at school. And then at that time, I found an idea from the US, like Amelia clinics. They have a telemedicines and they work like pros. So patients just go to um, the, the the pharmacy store and then get access to the doctors online. That's the idea inspired me a lot when it came back to Cambodia. And then at that time, I started to test the idea with my friend, with a group of my friends, the co-founders. And then we do a survey with a group of people, like 30 people, about what happened if we have these kind of solutions, telehealth, online doctors, but they don't like it at first in 2018. And then we also talked to doctors, and doctors mentioned, um, when we cannot listen to patients' lungs, or when we cannot touch patients, they don't think it's a good idea to do it. At that time, I think, okay, it might be not be able to run a telehealth startup in Cambodia because it's too early and it's new to them and they don't like it. So most of the co-founder want to give up those ideas, but because of my personal issue and my father, he's actually got a stroke. He got a stroke and then he cannot move from one place to another place. And at that time, he's got skin disease, and then I do online consultations with a Japanese doctor in Japan. And after 1 month, we got a very effective treatment from that time. And then I apply all the idea that I've done with the Japanese doctors with all the patients and all medical students at first. And at the first pilot programs, we got a very like um, a good feedback from patients with medical students, the first pilot that we've done. And then we start moving to another pilot programs with the real doctors. Like we have 10 doctors only who test with patients and gather all the surveys again. And then we trying to build up like a solutions with our MVP, like Docosan as well. But our MVP is actually very simple. We use a Telegram technology to do online consultations with between patients and doctor. And I think everything is run smoothly with Telegram. After that, we do a marketing with a big channel in Cambodia during COVID time. I think last year, 2021. Actually, at the first time we started operating, running our meet doctor, and then we got a lot of support, and like we created a channel and a group. In 1 week, we can grow like 0 to 10,000 members, subscribers, and then many like thousands people asking us every day. So that time, during COVID time, help us grow and a number of patients as well as the number of doctors. And then I think there would be more than that to do with patients in rural area because we haven't done a lot with them. And we also need to do more educations for doctor as well. Yes. That's how the story worked for me, doctor. Thank you.
But I think that's very interesting and very cool at the same time because both you and Beth say this is something that come from crazy ideas, but you both sit and listen, talk to the patient, and adapt at the same time. Especially when COVID hits, and you want to do more, and that leads you to the growth of both of your startup. And I think it's very excited to see and to hear the background of your story. So I'd like to turn to Dr. Kato now. Dr. Kato, perhaps can you hear my voice? I know he's missing a little bit, but okay, perhaps he'll come back later. So let me move to then talk a little bit about the situations within the region, and then we can go back with Dr. Kato and his arrive. So I'd like to go again to you, Beth. So when we're talking about what's happening in the region, sorry, okay, Dr. Kato, are you here with us? Can you hear me now?
Yeah, sorry for the bad correction. I
No
think
worries.
there's correct connections. I was
Okay.
out. Sorry.
No worries. Okay, so I think I'll ask Dr. Kato first. I was just about to to turn the questions to Beth, but I can ask you the questions now. So, Dr. Kato, we were discussing about how the pandemic has also influenced both Beth and Dr. Tong's startup. And as the Director of Healthcare and Long-Term Care Policy in ERIA, you have previously extensive experience, right, supporting government in health services. How do you see the state of healthcare change after the pandemic? What changes are here to stay, and what barriers are standing in the way? Over to you, Dr. Kato.
Yes, thank you very much. So definitely all national healthcare systems within the region and globally from all economic levels were tested during the pandemic. So most became overwhelmed, including small wealthy nations with top-of-the-line quality healthcare. So, but the most significant change that is here to stay is telemedicine. I think someone also mentioned that. So, while not perfect, because face-to-face clinical consultations are most effective, but confidence in virtual consultations become inevitable due to overcrowded hospitals for safety, to reach the most patients possible, and to decrease risks, especially to the elderly. In this regard, using user-friendly online platforms and maintaining strong internet connectivity are very important. The satellite internet industry, for example, can help break down these barriers to reach rural and far-flung areas successfully. Other challenges experienced were the innovations in healthcare systems and faster research and development in order to wage effective, timely battles against the pandemic. So observations on what kind of teamwork is necessary in each country by its government, private industry, and academic sectors become apparent and were different among unique cultures. So strengthening these teamworks would be a very key to prepare for upcoming pandemics and emergencies. However, we need to emphasize during such emergencies that teamwork include maximizing resources in R&D and refraining from excessive profiteering. This does not mean that manufacturers must refrain from earning unethically acceptable profit, including middle traders, need to be discussed, I think. So while most challenges and barriers can be discussed, including what is called the surge capacity, those are most impactful and widespread, I think. That's all from me.
Thank you very much, Dr. Kato. I think you also mentioned the importance of engaging with academia.
My connection is bad.
We can still hear you. Yeah, your picture is a bit frozen, but we can still hear you. So, okay, I'll again over to Beth first and then back to Dr. Kato. So I think Dr. Kato mentioned also innovation, right? And how telemedicine is here to stay. So Beth, I would like to ask, as the situation in the region right now, we are seeing a robust growth of health technology in Asia, accelerated by the pandemic. How do you see health tech startups drive these changes? And is there a room for more innovation?
There's absolutely room for more innovation, but I think what COVID-19 did is it really drove people online much faster than people were doing before. They had some pretty harsh lockdowns in Ho Chi Minh City in particular, where you couldn't quite leave your apartment or house to go out if you needed care. And so people really had no other option than to turn online to get basic healthcare needs that they had during that period of time. And I think it was a great introduction to people about how convenient and nice online consultations with doctors could be. It's a really different experience from the status quo, in which you have to find the doctor. Okay, who do you want to go to? Then you go offline, you wait in a line. There's probably sick people near you. Maybe it's not exactly where you want to be. Then you go and see the doctor. A couple minutes, he writes a prescription, and then you have to go to a different pharmacy outside. And so, yeah, it can be a little bit fragmented with like pharmacies being separate from laboratories, being separate from the clinics. And then just, in the context of a pandemic where people are worried about infectious diseases and not wanting to be around others, looking online was just so natural and so much more convenient. But it didn't just apply for COVID. So a lot of primary care can be done fully remotely as well. So during like the COVID periods, we would start selling rapid COVID tests. And then if someone had a positive result, then they could start an online consultation with a doctor who could then send a prescription to them. And then we get the medicine delivered to their doorstep, kind of end-to-end clinic experience. But that could also work for a lot of other areas. So say that you have like a particular rash or something, dermatology, or like, a sick kid with a cough. There's no reason that you wouldn't be able to have the same kind of flow and the same amount of convenience and just from your home. And so I think like what COVID did is it forced people online. And then once you experience like how much better online care can be, it's hard to go back to the old system of pure offline care.
Thank you, Beth. I think it is a it's very good thing that you mentioned that COVID is actually a good introduction to healthcare transformations, because now it doesn't only apply for online consultation, but it will inspire for many services to be able to be, the services will be able to respond to other type of disease, for example, not only COVID, as you said. So I'd like to go back to Dr. Kato to touch a little bit about what you mentioned about policy and health. So, Dr. Kato, beyond the pandemic, ASEAN, we will still face the long-standing healthcare challenges, such as increasing healthcare costs, aging populations, or threat of infectious disease. How do you think, in your experience, policies or healthcare policies should be best designed to address these issues? Over to you, Dr. Kato.
Yes, thank you. Hopefully the connection will be good.
But I can still hear you. Yeah.
So, yeah, you are right that these issues are compelling challenges. Timely prioritization is always a strategy. As well as G20 Bali, current policy priorities in healthcare are first starting with USC, Universal Healthcare, concerning its access to all. As asserted in the 1970s in Alma Ata, quality primary care healthcare is a human right. So therefore, ERIA recognizes the need to expand studies that can reinforce this right, and especially with good quality and less costly medicines and medical devices as well. And second is investigations on infectious diseases. Alongside AML or antimicrobial resistant, AML can render antibiotics and other medicines useless within this century. And but we must not always forget that non-infectious conditions as well. So many of which affect the elderly are also an emerging burden, like hypertension, diabetes, and cancer, as well as mental health. Therefore, ERIA does not exclude these top causes of morbidity and mortality in this region. And I also like to support the regional establishment of an ASEAN Center for Public Health Emergencies and Emerging Diseases, or ASPID, which I think last month was agreed to be located in Thailand and satellites in Indonesia and Vietnam. So such kind of international teamwork is very important, as I said. And for this year, a third priority is digitalization of healthcare, which is already we are discussing. And all of these, when integrated within a multi-sectoral team framework, meaning government units must plan and work together and with industry and academia will help to decrease healthcare costs, address the welfare of aging, and prevent infectious diseases. That's all from me. Thank you.
Thank you very much. And I think those are very important highlights that, more studies are needed, and also academia and also government are actually working together within the region itself to to promote and to be aware more on this issue. So I'd like to now turn to Dr. Tong. Again, we're talking about the situation within the region. And as we know, there's a growing market for health tech due to the increasing number of mobile users and internet penetrations in Asia and Southeast Asia. However, there's still a divide on access, for example, between rural and urban areas. What strategic actions can startups play to close this gap?
Thank you. This is a very good question. I think when we say telehealth, we gonna focus on the value of telehealth. What is the value of telehealth? Affordable and accessible. So accessible is the core value that telehealth startup trying to bring to close the gap between rural and urban area. And as the traditional healthcare service provider, normally in rural area, we have lack of access. I mean, most of the hospital clinic, they do not have their locations in rural area. Conversely, they have in urban area. So most of the people in rural area, when they got sick in moderate to severe conditions, they need to travel from rural area to urban area. So with this issue, we actually I'm trying to follow the mobile data service coverage. So how can the mobile data service coverage trying to provide solutions to the nationwide, to the country? For example, in Cambodia, we have map phone, smart, and cell card. Those are the internet network provider. We are mobile data, cellular data. The way that they set up, they do in the core area, which is urban area. They kick off in urban area because most of people live in urban area. So when we do it, we're gonna make sure that it would be sustainable, so that we can move our next steps to another area, which is a rural area. And then we're gonna set up some things in the rural area, like a center. At a center, which is that center is actually have the functionality to connect all the rural people to the doctors in urban area with the internet access at their locations. So seems like it's simple, but we also need to train. We need to provide a lot of training to the doctors, the people who take care of the centers, and we also need to educate the patients who do teleconsultations with the doctors. So the strategy is actually start with the urban area, train all the people who are smart, who have the knowledge with technology, let them use first. So the first adapter is very important, and then we try to extend our network by teaching. One person is like another person's, so that kind of network we're going to improve and we're going to close the gap faster. And actually, digital marketing and digital, digital marketing is actually the knowledge and everything that we can spread information is very fast. We can learn and adapt very quick through their what we can tell and what we can teach. Yeah, I think that's what we're going to do and how we grow and close the gap between rural and urban areas. Thank you.
Wow, you're actually answering my next questions to you, which is how you train and how you give preparations to health service providers, patients, healthcare services, to these emerging technologies and closing the gap between urban and rural area at the same time. So I would like to ask to Beth now. So Dr. Tong talked about bridging to close the gaps between rural and urban area. How about the bridging partnership between public and private sector? Because I know you also not only deal with public, but also private sector. Do you see what strategic partnerships that do you see important to build this inclusive health tech ecosystem in Asia? Over to you, Beth.
Yeah, sure. So healthcare is different from other industries in that, one, it is highly regulated. And that is to protect human life, and that's probably, definitely a good thing. And then, there's also like a public sector that is also actively providing healthcare to its citizens. And I think there's lots of room for collaboration between the two. So, for example, at Docosan, we built the national HIV/AIDS treatment guidelines app that is used by doctors across the country. And we were privileged enough to get to work directly with the Vietnam HIV/AIDS Authority under the Ministry of Health on developing this app. And so it was a wonderful example of like getting to work with, a small kind of like scrappy startup, working directly with the government on an initiative that made these guidelines for doctors so much clearer, easier to use, because it's just kind of like matching the right skills with the right the right person to build it. So for the government, they have deep policy knowledge. They understand their people very well. They know kind of the best direction for doing that, and they have that great kind of skill, clinical knowledge. And then for us, we're experts at building tech. At Docosan, we go out of our way to hire the best tech talent, and we use that for our main product as well. And that hiring the best tech talent shouldn't necessarily be the priority of the government when you've got private companies doing this. So why not mix the two? And so we were able to develop this app that is like super easy and friendly to use for the doctors. It's got like calculators and decision making tools, and the Ministry of Health can also send like mass messages out to the doctors in the network through this. And so I think it's all about kind of like matching skills and being open in both ways. Another interesting thing I think about startups and software companies in particular is that there's not necessarily just a pure revenue motivator either. Sometimes it could be something that helps like their branding and credibility. Of course, like, everyone is interested in being able to work with public sector if it's like possible. And then it could also just be about like, familiarizing people and increasing a user base. It's not necessarily that, the company itself has a direct profit motive in participating in something like this. So it can be win-win both for the government and getting some of the best tech possible, as well as for the startup and spreading the word about themselves.
Thank you, Beth. I think it's also interesting, combining and mixing experts, and also not only connecting to private and public sector, but also private to private sectors in a way, to be able to expand your network at Docosan. I'd like to again ask Dr. Kato. So from your perspective, what role can digital health plays in ASEAN? And is there opportunity to incorporate digital health to benefit the long-term care services?
Yeah, thank you. As I said before, digital health is a G20 Bali priority area. Actually, digital health means quite a broad, so it contains quite a lot of things. But one, for example, one is telemedicine. As we already discussed, telemedicine grew tremendously during the pandemic, and will continue to grow as we reach out to the rural area of these regions. With low bandwidth requirements, some software platforms especially can accomplish this. For example, specialists in urban areas can screen rural patients' data through a tablet or even mobile phone in areas where a specialist may not be available. Absolutely, long-term care services will be benefited in particular because then elderly patients do not need to travel alone. I think sometimes they cannot travel alone. Difficult journeys to visit their specialists regularly. So instead of that, they can now experience regular visits online. Also, I'd like to mention about the health data. Technically, digitalization can allow us to analyze health record, combining with geographical information, gender, ages, or result of laboratory tests, or medication or other treatments. So such an integrated analysis is definitely valuable, not only for making an evidence-based public health policy, but also an R&D or medicine or medical devices, and also developing a tailored long-term care program. So although there are a lot of barriers like privacy issues, cost, formatting data or cleaning data or so on, to accumulate and publish integrated health data and personalized data is quite important. So we must try to accomplish it as much as we can for public welfare rather than, of course, as well as private benefit, I think. So that's all from me. Thank you.
Thank you so much, Dr. Kato. And I'll get back to you on that because there's actually a questions in our audience about the protections of personal data of patients. I think it's from Katrina Navalo from Asean Japan Center. She's asking for both Docosan and Meet Doctor. But okay, so Tong, you're here. So I'm just saying that there's a questions about the protection of personal data of patients. Have you encountered any specific issues related to this? Are there cybersecurity policies in place right now in Vietnam and Cambodia? I think I'll go to you, Dr. Tong, first, and then Beth.
No, thank you, Amelia. Thank you for the questions. This is a great question. Actually, in Cambodia, we don't have any policy regarding to telehealth. So any like cybersecurity or like policy to protect the data, we don't have that. But for Meet Doctor, we actually we have idea to keep all the data secure. So our platform gonna follow another guideline from the US, which is called HIPAA compliance, and we're gonna follow that compliance in order to meet the standard, the international standard, so that when the government have set up the policy or everything, so that we can have everything in place. Because I was one of the committee that designed the HealthTech roadmap in Cambodia for the HealthTech, and I can see that government very concerned about the data security, and Meet Doctor is also prepared for that. So I think we don't have it for now, but we're preparing for that.
Thank you so much, Dr. Tong, and over to you, Beth.
Yeah, so in terms of like data privacy policies, it's rapidly changing and developing here in Vietnam. And so that being said, we also tend to look at examples from other countries to have at least like international standards of data privacy. And so we also follow HIPAA. It's great that yeah, we both have the same example. I'm from the US, and so I've been exposed to that before. We make sure to train the team in best practices among like handling sensitive patient data. And then I think it's also important too, because I said this before, but like healthcare is not like other industries. It can be life and death. And so it's important to have, the utmost respect for patient confidentiality, because like someone leaking, say like, the HIV status of a patient could be extremely harmful to someone's life. And so it's important that we keep this at top of mind.
Thank you so much, Beth. And I think one last question, and I'd like to give it to Dr. Kato, because Richard Holman Mananta from Indonesia asking your view on the current policy. I believe you talked a little bit about evidence-based policy and how to tailor a good policy for long-term programs for healthcare and health services. What can be improved from your perspective?
Thank you very much for your questions. And I think it's quite difficult question because it's very broad. But the important thing when implement policy, we always need to consider that there's a gap between policy and practice. So it's quite important to identify what is the gap existing and to try to fill this gap. So in terms of our past work, we have worked to collaborated with Bappenas in Indonesia to identify identify the situation of elderly people under the COVID-19. So this survey shows that actually the government provided the cash transfer services to elderly people, but even some elderlies really suffer from economic disruption, but still they didn't use these cash transfer services. Unfortunately, this survey didn't show why they didn't use that, but the first biggest thing is we can identify that gap. So we are now we need to discuss why that gap was emerged. Maybe from my experience in Japan, there is it takes quite a long time when they apply the services, but actually until actually the money was transferred. And sometimes the central governments try to provide as much as they can, but sometimes the local governments doesn't do that like that. So there is a gap between central government and local government sometimes. And also some people didn't know that services. So the government needs to more publication that advertisement that. So there are always problems like that. So our mission is to identify such problem and the gap when as well as helping to make their policy. So yeah, that's all from me. So unfortunately, I can't quite answer your question, but hopefully we can do that.
Thank you so much, Dr. Kato. And I think what you said is also increasingly important, because right now we sometimes, it's hard to match the policy and the practice. So first we have to know what are the gaps and how both private sector and also government are able to fill and to support to reduce those gaps. So I believe we are at the end of our session here. So if I can sum up quickly from this discussion, I think the first one is that the disruption of healthcare ecosystem caused by COVID-19 has accelerated growth in health tech industry, allowing startups to play as a role as a hospital without walls. We see and hear insights from you, Beth, and also Dr. Tom. And also the second one is it is interesting that Dr. Kato repeatedly mentioned about identifying gap and making a better or sound policy actions and also evidence-based policy actions. So I think those are the things that is key message, and hopefully you'll be able to inspire many more and be able to improve the sustainability of our health and health tech ecosystem in Asia. So again, with that, I'd like to once again thank the speakers and the audience that have joined in this important discussions. We're sorry we cannot address all of your questions, but don't forget, we still have 3 more sessions after this. But for now, let me close the sessions by saying health is wealth, and please stay safe, and bye for now. Thank you very much for speakers. Thank you. Thank you for participants. Thank you all. Thank you.